Thank you. I'm sorry for this diversion. It's not like I planned this. This is a time to talk about sexually transmitted diseases. What could be more important, given the class itself? Thank you. Goodbye. Oh, dear God. Did you go over all of this nonsense? Fine, fine. All that you can read through it. I don't want to do an anatomy lesson. Okay? We went through this. Occasional trespassers. Who cares? Okay. A couple of things. Are we going there? Hey, hey. Possibly. Don't worry about leptospirosis. Brooke, please. Gosh darn it. You should have skipped today. Now, if you had somebody else, they would go nuts. Don't pull that with nursing. They'll have your head. Okay, you got to get out of your system now. Okay, reading this, you can read through this. You can read through this. Okay, let's start here. Seemed like a proper thing. Okay, we don't. We'll get to all of these things. The fact that they're not sexually transmitted doesn't mean they're not problematic. To understand whether this vaginitis typically is the yeast, the vaginal yeast infection, what it's barriers. Whenever you have something ongoing, okay, in the male or the female reproductive system, and it's not, and there's something inflammation. What'll happen? There are microscopic breaks in the skin, which is your major boundary. You can get something from unprotected intercourse. You can get something from oral intercourse. I mean, it doesn't, without going crazy about, identifying all the nuances that are there, understand that anytime a barrier is compromised, which would be a good word, it increases the risk of a problem for you or for people, from a nursing perspective or a medical person perspective. Then all of a sudden, in the back of your mind, go, "Uh-oh, this is a problem looking to happen." Vaginosis is something a little bit different. We think it's an anaerobic bacteria. We'll get to that. Probably not. Prostatitis is almost always infectious and typically does not create a problem, though it's relatively common in men. Okay. It's a perfect statement from this textbook. After the advent of HIV/AIDS and its identification, and all of a sudden people becoming very wary, now that there's an abundance of treatment, the perception was everything was treatable, and it is not true. Okay. Herpes and HPV are forever. They're forever. And once you get them, you have them for good. Is there a treatment available for herpes? Yes. But everything runs its course over time. So this is part of the reason. For years, we treated people every day in the emergency room, repeat offenders so many times because they come in and get a quick shot, okay, and be done, and take a bunch of pills, and they'd be done for a while, and then come back in, here we go again, okay, if they were competent about it. And the same would be true for chlamydia. These are all treatable. Unfortunately, we're beginning to things, the longer they're treatable, all of a sudden they become untreatable. And you can blame it on who you want, okay, and STD clinics and all that type of stuff. But the bottom line is, it's about education and more than anything else about personal behavior, I think. I do not know how well we're going to be able to shift screens with this. I see that problem. So we'll do it the old-fashioned way. Okay. I'll just scroll through it that way. The way they do, because this will occasionally lock up in here if you did not know. Discharge, they classify it differently. The other textbook that I like, Nestor, classifies it whether it's viruses or bacteria. They do it with regard to discharge diseases. This is as important as any. These are the big players. The number one, chlamydia, the number one bacterial by number sexually transmitted disease. More new cases of that every year than any other bacterial disease. Trichomonas vaginalis, called trichomoniasis, which is a parasite. It's a protozoan. It is by far and away the number one disease for new cases every year. The most recent textbooks that I've seen, and these are now about 6 to 8 years old, they were talking about 8 million new cases every year in the United States. Not worldwide, in the United States. Think of that. A lot of them are repeat offenders because it's treatable. The fact that something is treatable, people get a false sense of security because even in the process of treating chlamydia or treating trichomonas vaginalis or treating gonorrhea, you're predisposed. It opens the door for everything else. There's multiple infections. This is the problem with when they use the term sex workers. I understand without getting into the sociology and ethics and all those discussions that the more sexually active people are, the increases the likelihood considerably. Okay, so the infectious agent, and this is why they call it the way the evidence comes from the discharge. We look at the discharge, we determine everything from taking samples of that and evaluating it. Sometimes it's easy, sometimes it's not. And then there's all sorts of things. Is it painful? Is it discolored? Is there a foul odor associated with it? Are there other signs and symptoms that are associated with it? Say, and it's very easy because they make contact fairly easily with partner, and then we begin to talk about multiple partners, et cetera, et cetera. So let's start. We'll kind of look at it from there. Gonorrhea, in general, and forgive me for phrasing it this way. Okay, it's a lot of times people either don't notice or choose not to notice something based on the fact it doesn't hurt a lot. Okay, gonorrhea hurts a lot. In the male, extraordinarily so. Okay, in the female, maybe a little less so, but there's very much of a distinct drainage, and the drainage typically has a pus-like appearance. And anybody who's going around ignoring that stuff is in big trouble. Okay. So these are the so urea, and these are constant in the male for all of these. And in general, the male is much more. I hate to phrase it this way. The male is much more symptomatic. The male doesn't care as long as the system is working. Okay. And that's the big trouble. 50, 75, 80% of the time, men are symptomatic, but the degree of symptoms doesn't dissuade them from the activity. Unfortunately, less than half of the time, and frequently only late in the course of sexually transmitted disorders, does the female notice it. And by that time, it's what we call pelvic inflammatory disease. All those anatomical structures, the broad ligaments, the ovaries, the tubes, all of them get inflamed. And at that point, now you've increased the risk of early hysterectomies, ectopic pregnancies, infertility problems, significantly. Okay, permanent damage. So I can't, for years, why people ignored it, it comes back in history. People couldn't get the idea that having intercourse should be a problem. How can we transmit disease that way? Now we understand it. And so you've got to go through the education process. Again, in this country, we're very provincial. I hate to be preachy about it, but it's absolutely true. It's not the kind of stuff that in this country, families still don't sit around. Think of your own family existence if you sat around and talked about it. Go to Europe, it's a lot more table talk. They understand these things. They've been around for a long time. We're a different country in that regard, and that's why it's crazy that the United States has this extraordinarily high rate of sexually transmitted diseases. I mean, it boggles the mind. And look, you're talking to an authority about things like this. I mean, someone who really knows what they're talking about. Their daughter wouldn't have had her baby before she was 16 years old. So take it for what it is. And her mom and dad were a doctor and nurse, or are a doctor and nurse. I'm not in the past tense, despite what I'm thinking. Okay, so this is classic for the male. Pain, burning. The discharge is purulent. That's the pus, that yellowish pus. The cases that are symptomatic are not in the male. And yeah, I'll buy that. Mostly it affects the urethra more than anything else. But yeah, it can certainly spread. And the problem with scar tissue is just that. It can render a male infertile. And it's much worse than the female, if you could possibly think of that. It is an extraordinary, the bacteria, when it flourishes, and it doesn't, and once it's outside of the body, it dies very effectively. It is such a fastidious bacteria. It's extraordinarily hard to grow in the lab. You need special agar, special conditions, all about those things. But it adheres to literally everything it can touch. Anytime there is septic arthritis in an adult, it is gonorrhea until proven otherwise. If it gets into the bloodstream, it has a predilection to go to joints. I can't tell you how significant that is, because pus in joints is extraordinarily destructive. And I mean, now you're getting into something. Gonorrhea is a gram-negative diplococci. That means you have all that gram-negative sepsis going on. So as you can see, mucus, pus, bloody vaginal discharge may occur, painful urination, big-time complications. Salpinge is prefix we use when we talk about fallopian or ovarian tubes, etc., that are there. Here's the PID nugget. And that's what they're talking about. Irregular formations in here. And that's where fertilization occurs. Okay. And so the likelihood of an ectopic pregnancy increases dramatically. So not unusual for the microbe that causes PID to become involved in mixed infections, scar tissue, etc., the whole ballgame. Doesn't matter. Consequences are significant outside. It's not a large number of cases, but joints, then skin. Joints, wrist and ankle, chronic arthritis, rashes that can sometime occur. The same, it's in the family, it's called Neisseria gonorrhea. Again, a gram-negative diplococcus. Neisseria meningitis is the leading cause of bacterial meningitis in adults. So yes, once it gets in there, big problem. So it can go over. So there's no question it's a killer. This is the other problem. We have to screen for it. It was the leading cause of blindness. That keratitis, we had a name for it, ophthalmia neonatorum. Ophthalmic changes at birth and blindness. That's the reason for years they started with silver nitrate drops. Okay, turn the baby's eyes black. And we talked about this. Now it's strictly antibiotic drops. So I didn't mean to yell at your book. I'm sorry, but it's a serious lecture. I'm waiting to hear whether my son, we have an expression in the middle of clusterfuck about what's going on. He had to come all the way to Pennsylvania to get a document that said there's his license is in perfect order. He must have missed a hearing for a driving offense 25 years ago, and somehow that's on Florida finds this. Pennsylvania doesn't even know about it. So we're hoping Florida doesn't go nuts because he drives professionally. Hazmat driver. He's having a kitty, as am I. Gonococcal eye infections, very severe. Antibiotics, universal precaution. Other than neonates, is strong evidence for sexual abuse, and I will buy that. It just doesn't occur. And that's another thing you have to talk about with these kinds of things. Unfortunately, many of you will see evidence of this. It is horrible. You will be, look, we don't hurt our patients, but boy, you'll be tempted. We saw this. So here it is, gram-negative diplococcus. Yeah, kidney bean shaped. They're kind of like little coffee beans. And you see them inside of a white blood cell. That's the giveaway. When we'll do a smear and we'll do a gram stain like you've done in lab. If you see gram-negative diplococci inside a white blood cell, it's gonorrhea. So you treat it appropriately, and you have to be very aggressive. It used to be penicillin would work. Nowadays, we're starting to see resistant cephalosporins are still probably the treatment of choice, as I recall. It adheres to anything. All those the fimbriae, these anchoring tips, is absolutely true. Slows down effective immunity, some variation that causes the likelihood. It doesn't matter. There was a case they were telling about. A rheumatologist was telling a case in maybe I told you in the city because he was in San Francisco in a homosexual, the gay male population. I want to use political. I don't know what the politically correct term. Forgive me. Okay, in the guy's ear. You know, that's as far as I can go. We all looked at him and go, "Oh, you got to be kidding me!" But it's absolutely true. Okay, rearrange themselves, antigenic variation, cleaves IgA molecule, all of that means it has tremendous defenses for treatment. It's a very aggressive disease. Okay. Sexual contact, strictly human, most common sexually. And this was in 2018, 7 years ago. You know, that's more than 500,000 new infections we're talking about in the United States. We're not talking about the 8 million or so from Trichomonas vaginalis. Okay. Asymptomatic males and females, very significant. As you can see, 90% of the males are symptomatic, 50% of females are symptomatic. So that's significant, and that's the problem. And I'll say it again and again. Whatever your lifestyle is your choice. You accept the consequences of that lifestyle. You should at least be intelligent. I don't know what the proper word is. You know, behave responsible enough to get yourself checked on a regular basis. That's all. Oh, what else can you say? No, didn't want to do that. Might lose it. Again, very difficult to cultivate. Don't worry about the testing. It's a reportable disease. That means we can still try to get it under control. Very barrier methods work. Okay. Co-infected with chlamydia. So, understand we see a lot of these. They've got one. They sometimes have more than one. Okay. Prevalence of antibiotic resistant strains, urgent threat. So it's getting a little bit harder to treat. Though again, chlamydia, the most common reportable infectious disease in the United States. Hello. What happened to trichomonas? Not reportable anymore. We can't control it. There's so many cases. Out of control. 1.5 million cases annually. That means the rates are 5. Remember, that's reported. The fact that it's reportable, people don't often do that. Okay. Vast majority of cases are asymptomatic, tiny gram negative. It lives inside the cells. That's why cell wall agents don't work terribly well. So typically you're using fibromycin, erythromycin, Z-Paks work well. Okay, and there's 2 stages. I don't ask about this, but we'll get to the stages. And it goes through an active and an inactive stage. You should recall for future the name of the active stage. Okay, inflammatory, all the same things, except it doesn't have that yellowish discharge. It's more of a clear discharge. Before we knew about all of these other things, back when I was learning about this in the mid-70s, they called it NGU, non-gonococcal urethritis. And that was a global term for any urethritis, any discharge disorder that wasn't gonorrhea. They didn't know this. They didn't know chlamydia was chlamydia. They didn't know trichomonas was trichomonas. They treated them similarly, typically antibiotics. And the usual advice and things like that. And understand, this was the climate, why it was rampant. I told you about it. This was casual sex. Multiple partners. This is the pre-HIV AIDS era. Oh, don't worry. If you get it, somebody will fix you up. Okay. So here you go. PID frequent in the female. More likely to experience PID as a result of chlamydia than gonorrhea. That's scary. 75% of chlamydia infections are asymptomatic. And what happens is the symptomatology, it doesn't until they're doing a pelvic exam, and all of a sudden during the examination, extraordinary pain as they begin to palpate the area of the ovaries. Pain. That's proof positive. Okay. All of those, and the same issues for all of these were that kind of a problem. You can go into the lymphogranuloma venereum is rare here. It's more common in tropical areas. It's rather gross. So tropical areas, uh, let's say non-controlled sex workers. That's a nice way of saying we're not talking about legal prostitution. We're talking about human trafficking and things like that. We begin to see that. Yeah, it's again. There's going to be some non-specific symptoms. Lymph nodes getting it. That's bad, and all of those things can lead to significant problems down the road. Typically, we don't see it so much in this country, but in other parts of the world. So, I mean, with the abundance of, despite what they're talking about, clinics being closed and all those types of things, the reality is our healthcare system is a lot healthier than every other places, as far as I am concerned. Okay, again, this has become a greater problem now because it's more common than gonorrhea, chlamydia. And it's not just eye infections, but though that's the most common, they call it a trachoma. They name the bacteria for what occurs in the eyes, trachoma, and pneumonia also. That's why it's so important for prenatal care. Things like gonorrhea active, chlamydia active, herpes active have to be treated and under control, or else, really, if you have the option, you have to do a C-section. So again, all of these types of things now. Okay, conjunctivitis, contact with maternal chlamydia, most prevalent form of conjunctivitis. Says it all. Well, this is the thing. Okay, this is the I'm not going to ask you. That's like an NCLEX style question, elementary body. Okay, and then once it's inside, it becomes a reticulate body. Okay, and so they just keep changing. The elementary bodies are released from the cell as it grows inside. Again, it's intracellular in nature. So remember the term elementary body and reticulate body going forward. To me, it's that's just, let's play memorize the name. I'd rather have you understand the process. Intracellular, cell wall. Again, it's all about the same thing. When you have it's a gram-negative infection, and gram-negative means your immune system, cytokines, inflammatory changes, all the bad stuff that we saw with gonorrhea. Again, humans rising. Notice that refers to infected cells, so we see this more in adolescents. I don't know if the statistic is true. I suspect it is. For the longest time, the area where we're seeing the greatest uptick in sexually transmitted disease, middle schoolers. Okay, 50% untreated babies born to infected mothers will acquire conjunctivitis. Scary. These are the way that you can screen for it, and I mean, test. The more common they are, the more testing that'll come to the fore. The usual thing, barrier methods. It's been my experience, see my daughter, that abstinence doesn't typically work. We ignored some advice from, because she had a variant of what's called bipolar 2. If you did not know it, folks with bipolar are typically much more promiscuous in their adolescent years. We happen to ignore that recommendation. Oh, we'd rather have a lovely granddaughter. Soon she's going to be over. At least she's 23. It's okay. An experience, as this is experience for everybody. Okay. Again, anytime there's a new partner, think about it. Not, trust but verify. Doxycycline says the Z-Pak or Vibromycin, co-infections, checked, etc. Partners need to be checked. It's a very hard conversation to have with individuals. For years, the health service did this. I mean, they'd ask for the names of your partners. They would go out and ask them. Yeah. If a relationship can withstand that, it's probably going to endure. It would be my own opinion about that. Here we get the difference between vaginitis and vaginosis. The itis means inflammatory, itching, burning, reddening, discharge. Almost always, Candida albicans. yeast infection. Eminently treatable with topical agents. I had tremendous amount of success, I've told you, with diflucan, fluconazole, orally. A lot of patients who used antibiotics were predisposed to this because the yeast would flourish. It's the same organism that causes thrush. Probably more than half of this have this colonized at any one time. I've had thrush on multiple occasions with the immunological agents or the immune suppressing agents I was taking previously. So there's just a whole lot to it that's there. So and thankfully the treatment is effective. It's unlikely to spread, but again, I would say until it is at least resolved, improved, and probably a certain degree of abstinence wouldn't be a bad idea. Vaginosis was different, and the osis means condition. This is the one that's associated with a somewhat unpleasant odor. It's very stigmatizing. A lot of people use a variety of sprays and other agents to try to offset that. The reality is, most of us believe there's a grouping of factors. We think there's anaerobic bacteria. There's some statistics about particularly girls being sexually abused as children that may lead to it. And I don't know what the current theory is, to be very honest with you. But I think it's an educational thing to understand that. And you're going to see one of the magic things that we have is the antibiotic we talked about called metronidazole. Metronidazole or Flagyl, a name you need to know for the exam, is the drug of choice for vaginosis because we think it's an anaerobic, is a culprit with regard to this, because it's typically a mixed infection that may be causing it. At the very least, the treatment is fairly effective, and you'll see for Trichomonas vaginalis, okay, which is an anaerobic protozoan also. One's an anaerobic bacteria, that's the vaginosis, and one is the anaerobic protozoan. The metronidazole or Flagyl is the drug of choice. It's very easy to tolerate, 10-day course. Headache's about the only side effect that I can think of. And we saw this in the lab. That was when you were looking at yeast in the lab, you were looking at, not Candida, you were looking at Saccharomyces cerevisiae, which is brewers and bakers yeast. Looks like. Okay, normal biota, most of us, the mouth, any of the openings that are there, they're there. So yeast is easily detectable. You can stain it with a simple stain. The hyphae, we call them pseudo hyphae because they're just the stranding that's going on. They're actually a slightly different form. Pretty easy diagnosis, looks just like that. Limit to the surface. If it's in the bloodstream, then we're talking about somebody with an immune system effectively has collapsed. That's when you receive it. So when you start to see fungal infections getting into the lungs, getting in the bloodstream, is very, with rare exception, that is usually someone immunosuppressed, and most of the time we're looking at AIDS patients. Hospitalized AIDS patients are at risk. They're opportunistic, any kind of disrupt, and there's lots of things that can disrupt it. Trauma can disrupt it. Broad-spectrum antibiotics, by far and away the most common cause, diabetes, pregnancy, and some during different alterations during menstruation. There's so many hormonal changes that can impact the nature of the normal flora, alter it. And understand, it's typical, as long as the other bacteria are flourishing there, they keep it under. The big player in all of this, in the female reproductive, is lactobacillus. Lactobacillus is if you look at it cross-eyed, it will die, much less give it a strong antibiotic. But it flourishes because it feeds on glycogen and estrogen during the non-menopausal or pre-menstrual years. Okay, estrogen is abundant. The estrogen, the lining cells feed on the estrogen. They produce glycogen. This bacteria flourishes. It tells you what it does. It ferments it, lactic acid. The acid is the protection. Other than that, pre-menstruation, postmenopausal mucus. Possible, but rare. Immune system, again, would be involved. I certainly would buy that. It's typically not chronic or recurrent. Usually there's an underlying factor. Again, diabetes, medication-based, certain responses to broad-spectrum antibiotics, topical and oral azole drugs, very effective. Okay, the topical ones are all over the counter. Use those first. And here's the vaginosis one, BV or bacterial vaginosis. That's that fishy odor that's associated with anaerobic metabolism, likely a shift, and I would agree with that. There's certain bacteria that they find that you really don't have to know. Gardnerella is the name, and you don't have to know it, is the anaerobic organism that we see a lot of it here. There are certain microscopic findings that are part of it, not well understood, but yes, can cause big problems. If you did not know it, low birth weight, what we call weight per date, even in a preemie, we have an idea of it. Low birth weight is a bad thing. Full-term babies under 5.5 pounds. This is my pest here. But it's about 4.5 pounds, but he's preemie by about 5 weeks. Here's the Gardnerella. Okay. Yeah, I mean, you can read through that as well as I can. It's just, we do not understand it that well. The treatment's more what we call sort of, the nice word is empiric. We call it seat of the pants. I mean, if it works, we keep doing it, and that's useful. So that, again, that's the metronidazole aspect of it. You can see something in the epithelial cells covered with adherent bacteria. There's differences, see your pap smears. I mean, you can go crazy analyzing these things, but whoever the physician would be, if they're not convinced, and if it doesn't respond to treatment, then that would be the next order of test, I would think. IUDs, I don't know how popular they are now. You folks would know. It's like anything else. Things go from being very popular to not being popular. The Copper 7 was extraordinarily popular back in the 70s. And then there were all sorts, and there were problems associated with it. Oral or topical, I'd say oral metronidazole, clindamycin or Cleocin is another one that works well on anaerobes, but has more GI side effects, if you can imagine. Here's trichomonas, okay, protozoan. And what happens is we classify them based on how they move. They move with flagella, very common, just like bacteria. No cyst form, doesn't survive long. Asymptomatic infections to start, okay? Males very rarely, and here there's just a discharge. Sometimes, again, if the discharge is cultured, even you can see movement when they do like a smear and just a stain. There'll be little areas which seem to be like twitching. That's kind of one of the things they look for microscopically. More susceptible to HIV, infertility, all the bad things that are there, easily transmitted. Okay? So again, it becomes, when someone transmits to somebody else, it is, I mean, rampant. I mean, maybe they'll have the statistics in that. Yeah, they don't. Again, the last time I saw statistics of that was like from 2018 or 2016. 8 million new cases here in the United States. To me, the pecking order, the one that has affected the most people, because once you have it, and we keep adding to the number. So we're talking about 50 to 75 million exposed as HPV. We begin to, next probably in the pecking order for new cases or recurrent cases would probably be trichomonas and then herpes. Again, herpes keeps adding. Prostatitis, bacterial, really not to me that relevant in this. Typically, once it occurs, you generally see there'll be a certain amount of blood. Having had it, I can tell you more about it. And the treatment is with antibiotics. There's usually some, I mean, typically it's associated with prostate disease, or with me, aspects of my treatment from bladder cancer were all part of this. And again, frequency, urgency, blood, but not giant amount of blood compared to, bladder cancer, painful ejaculation. And again, and they typically use, because the presumption is it's gram negative, ciprofloxacin, or it's ciprofloxacin and levofloxacin are both in that category. You remember that from the antibiotics. Okay, those agents particularly suited for gram negatives, and that's something to remember. We're almost done. Yeah, what will be done here on Wednesday? We'll do the ulcerating diseases. What we're going to have to do, I'm going to probably have to do the dictation on wounds, unless I can fly through this, and losing these 10 minutes did not help. So thank you. Sorry to be yelling at people. I know whenever this happens, it's the last week. I know. Goodbye. Oh.